webcast is now starting. All attendees are in listen-only mode.
Welcome everyone to the Chore Services RFP webinar. We are the Department of Family and Support Services. This Chore RFP was released on April 16th. Today is the webinar, and the due date for this RFP is on May 27th at noon. Next slide, please. As far as housekeeping, due to the volume of participants we have on the call, everyone has been placed on mute. Please submit any questions via the question box on the panel, and we will respond to your questions after we go through the slides. And you can use the question box also to notify us of any technical issues. We will have a portion at the end where we will do questions and answers. Next slide. As far as the agenda today, we will review our welcome and introductions, the purpose of the Chore Services RFP, the background of our department or division. We will review the Chore Services program model, selection criteria, timeline, any technical assistance needed for applicants through E-Procurement, and then, as I mentioned, questions at the end of the presentation today. Next slide, please. So introductions. My name is Stacy Subita. I am a licensed clinical social worker, supervisor of family and support services under the caregiver portfolio. I also have with me today Karen Cobb-Flood, who is the manager of family and support services. She oversees my portfolio in addition to other portfolios within the division, including legal services and nutrition services. Margaret LaRavery, she's not on the call today, but I wanted to include her name as she is our newly hired executive director of our AAA, as well as the deputy commissioner of senior services. And then also joining me is Julia Talbot, who is our senior policy analyst, and she'll be explaining the e-procurement information at the end of the slides. Or I'm sorry, after our presentation. Next slide, please. The purpose of this RFP today is we are seeking proposals from qualified in-home care provider agencies who have had experience assisting older adults with activities of daily living, things like bathing, grooming, dressing, or instrumental activities of daily living, which include shopping or housekeeping medications for older adults 6 years of age or older in the city of Chicago. Next slide, please. And I will have Karen kind of review some of the background as well as some of the program requirements as well. Karen?
Thanks, Stacy. Am I still muted? You can hear me. Okay, good. Sorry, thank you, Stacy. First of all, I'd just like to really echo what Stacy said. Thank you for joining us today. This Chore RFP is one that we're really excited about. We know that chore services are crucial for older adults when they come into our system, sometimes because of issues they've faced living independently, and certainly as we look to put in intensive services or services that are a gap between other services that we hope to get in place. So I welcome you all to the webinar today, and thank you for being with us. And Stacy, thank you for the introduction. Now, just some information about senior services, of course. We are the local area agency on aging for the city of Chicago. And I always think it's important to remember that area agency on aging funds come from our federal leadership at the Administration on Aging within the Administration for Community Living. Those funds go out to provide services to older adults across the nation. They then go to State Units on Aging, which of course in Illinois is the Illinois State Unit on Aging, and then to locally to the area agencies on aging. And recall that that's really to ensure that the services that are provided by the area agency on aging reflect the individual needs of the area that they serve. So this really provides us an opportunity to think flexibly, to think creatively, and to think thoroughly about the needs of today's older adults. So that said, the Area Agency on Aging is within the Department of Family and Support Services. We coordinate and fund services for older adults at a federal level, at a state level, and with local funding. We work with our aging network partners, of course, and also provide support to people who live independently in their own communities and homes as long as possible. We ensure that those who live in institutions are treated with dignity and care, and guarantee that older adults are included and have accurate information and opportunities to participate. You on the call are delegate agencies, our service providers. You're all crucial to the services that we provide, and we see you as partners. And directly in home, we provide INA assistance, of course, our congregate and home delivered meals, our senior centers, both our 6 regional senior centers and our 15 satellite senior centers, fitness, caregiver support, in-home services, and more. Next slide, please. So the goals of the Chore Services program, as we discussed earlier, are to really meet people's temporary needs for the activities of daily living and the instrumental activities of daily living. And of course, I know all of you on the call know those activities in and out. So the ADLs, as the activities of daily living are called, for example, can people ambulate around their place? Can they bathe on their own? Can they feed themselves? Can they get dressed on their own? And then the IADLs, which are more general in nature. Do they need assistance with medications, finances, et cetera, et cetera? So the goals of the Chore Services program are also to secure our older adults' safety in their homes. And of course, our long-term goal is always to prevent premature institutionalization. Next slide, please. So our target population for this is, of course, consistent with our Area Agency on Aging funding through the Older Americans Act. So we're looking for folks who are 60 years of age and better, who again need assistance with those IADLs and ADLs to remain at home, and they live within the city of Chicago. And there's no limitations there as far as how long they've lived here, or if they have to be a citizen or not. So that's really important to recall. And while we do serve all individuals over age 60, we do give priority access to individuals who are frail, who have the greatest economic and social needs, with limited English proficiency, low income, and those who are minority older adults. Next slide. Now, it's also important to note that we continue to look towards equity as a framework for all of our RFPs and for the way that the City of Chicago is actually providing services. And you can see some of the specifics around that, and this, of course, is also illustrated in the RFP. But in particular, we are committed to reducing disparities based on race, color, national origin, age, gender, sexual orientation, religion, disability, and other potentially discriminating factors for citizens. And in particular, in senior services, as reflected in the population of Chicago, we serve a diverse population of older adults. And so to that end, for our reporting needs, we, of course, have the expectation that respondents will collect demographic data to continue how we're monitoring how Chicagoans are served. And of course, with the Older Americans Act, we do need to know age. And we do ask if you're able to collect additional information for us, but of course, those remain voluntary by the older adults and their caregivers. Next slide, please. And so, Stacy, I should do this one, right? Or is this, you're taking over at Program Requirements, right?
I can. Yeah, I know that you had to hop off, so I'd be happy to take over from here.
Okay. Thank you again, everyone. Have a good day. Thanks, Stacy.
Of course. Okay, thank you, Karen, for presenting on that piece. So as far as the program itself, it is divided into two different types of services. So we have the chore short-term services as well as heavy-duty chore. Our short-term services are utilized to provide temporary support to care recipients who may be recovering from an illness or hospital stay, life transitions because of a loss of a loved one or relocation, or other significant life events. We try to work with the individual to develop a person-centered work plan to include services that would be provided. Next slide, please. So allowable services for short-term services. Again, we mentioned our ADLs and IADLs, which are all listed here. And so they can assist with housework, they can assist with packing items, you know, dressing, eating, that sort of thing. Next slide here, please. So again, since this is a short-term service, it is temporary. We do not exceed 48 units of service per client per year. A unit of service is 1 hour. So again, that's 48 hours total for the fiscal year. And usually this is about a 6-week period that this is you know, completed. We can provide extensions above this, but it has to be authorized by the DFSS program manager. Next slide, please. Heavy-duty chore services are a little bit more intensive. So these are cleaning for individuals that may be in living conditions that could pose a threat to their health or safety. These include hoarding situations. So the respondent, again, will work with the client to develop a person-centered work plan to make sure that we're able to provide this service. Next slide, please. So these might include things like carpet cleaning, moving things, moving and cleaning furniture, again, packing and disposing household items. Perhaps, again, if it's a hoarding situation, they don't have safe pathways, and so being able to help rearrange items in the home to prevent injuries or falls. Trash removal, washing floors, walls. Because this is heavy-duty chore service, we do also expect of the delegate agency to assist with cleaning. They might have to go into homes that might have infestations or bodily fluid situations. So we ask that they take additional precautions to make sure, you know, that they can provide this service. Next slide, please. Since this is heavy duty, we do offer a little bit more hours for this service. So we ask for 60 units of service per client per year. And it is determined on a case-by-case basis. We receive referrals through our information and assistance line, and they get evaluated by our care coordination units or managed care organizations, you know, that they are eligible for this service. In some cases, again, additional hours might be needed according to the scope of the you know, the situation, and these can be authorized by contacting the program manager. Next slide, please. So the respondent is responsible for entering data into our tracking system for their client visits. As I mentioned earlier, our CCUs and our MCOs, they're the ones that will do that initial determination of need. They assess that situation and then send it to us, DFSS, and then we make the referral out to the delegate agency to complete the service. Reporting requirements could change depending on our funders. Next slide, please. As I mentioned, a unit of service is 1 hour of staff time expended on a client, and then preparation of any reports or grants is considered administrative responsibility, so those are not billable activities. Next slide, please. Due to the pandemic and other emergencies that might occur, such as weather, we do put special emphasis in this application to be able to develop contingency plans for any emergencies that might happen. Again, we've had a lot of lessons learned this past year, and so we just want to make sure that our service delivery includes safety precautions and that we ask that the selected respondent provide policies and procedures, including sections on training, PPE, and make sure that these procedures are in accordance with guidelines from the CDC, IDPH, and Federal Emergency Management. Next slide, please. As far as staff qualifications, the respondent is required to assign and maintain for the duration of services staff to be able to perform these services. And they will also make available proof of any job descriptions and resumes with the application. Next slide, please. And so the appropriate staffing pattern for this program, we do ask that the respondent have a program coordinator or director who would be the key contact for DFSS. This would be the person responsible for receiving the referrals from us, as well as they are the person responsible to arrange and have overall accountability for this service. This position could not be vacant at any time during the contract period. And of course, as you all are in-home care providers, we ask that you have trained homemakers or home care workers to be able to provide the actual in-home service. The service provider has to be a licensed business to operate in Illinois. They should be able to continue services regardless of staff turnover, provide regular training and supervision to chore workers, and should be able to maintain the worker schedules, timesheets, documentation of service provision. Next slide, please. And so we just ask that you follow all the background check requirements and screenings. We are working with older adults who may be vulnerable, and so we just want to make sure all the staff that are working with your program and have any direct or indirect contact with our individuals have a completed background check. This goes into more detail in the actual RFP, but we just want to make sure, again, that they're checked with all the registries, sex offender registries, the APS registry. And so just please include any written policies or background check procedures that you have. And the delegate agency is responsible to report any incidents to DFSS. Next slide, please. As far as program performance goals and outcomes, we do keep track of the goals and outcomes with these performance indicators. So our performance indicators are including but are not limited to 80% of the clients indicate that they are better able to manage at home as a result of the help that they received. 80% of clients surveyed indicate overall satisfaction with services. 100% of the referrals are responded to within 1 business day of receipt, and 100% of eligible and responsive clients receive the chore services. Next slide, please. To be able to monitor this progress, we do track output metrics that include the number of clients and number of hours provided monthly for each of these services, both heavy duty chore and short-term chore. In addition to the performance indicators that we listed above, we encourage respondents to also monitor and track their own indicators and metrics to be able to demonstrate success of the program. Next slide, please. In addition, as part of our contract management and data reporting, we do ask that the respondents have client files that they keep that is confidential and secured in a locked space, that they have procedures for complaints and grievances. Also program evaluation and satisfaction surveys. We do ask that our respondents administer a survey that measures the client satisfaction with the services. These surveys are required to be reported on a quarterly basis. And then we do have a computerized tracking system to be able to monitor the data. And so we ask that the providers have a reporting system that will ensure accurate and timely reports. We also conduct quarterly meetings with our respondents or delegate agencies. So, otherwise sometimes these may be monthly meetings depending. So that is also part of this program. Next slide, please. So the anticipated term of contract for the Chore program, it will start, our current year ends September 30th, and so this would be for October 1st, 2021 through September 30th, 2023. So it is a 2-year contract, but then there is an additional opportunity to extend the term for up to 1 year. We anticipate awarding one contract for up to $100,000 annually. Our contract at DFSS operates on reimbursement basis only, so we do not give advances. Next slide, please. So the following slides talk about our selection criteria and our evaluation process. Each eligible proposal is evaluated on the strength of the proposal and the responsiveness to the selection criteria. We reserve the right to consult with other city departments during the process, and the respondent who is selected must be ready to proceed with the program within a reasonable period of time upon contracting. Failure to submit a complete proposal or respond to all the requirements will cause the proposal to be unresponsive and subject to rejection. We also reserve the right to ensure that all services are available citywide and provide a linguistic and culturally appropriate manner. Next slide, please. So we look at the strength of the proposed program. We look at is the respondent clearly defining the services to be provided? Are they going to be addressing the outcomes for the targeted population? We look if the respondent demonstrates a clear understanding of the target population and their needs and challenges. And we also, as I mentioned, are looking for contingency planning around emergencies. Next slide, please. Performance management and outcomes. So we look at evidence of strong past performance against desired outcome goals and performance metrics or other notable accomplishments in serving this population. The respondent should have relevant systems and processes to be able to track and report performance on program outcomes. They should have experience using data to inform and improve their delivery of services. And they should have relevant systems and processes in place to collect any key participant data. Next slide, please. We also look at organizational capacity. And so does the respondent have qualified staff responsible for program oversight and sufficient for staff for service delivery? Does the respondent have adequate systems and processes to support monitoring program expenditures and fiscal controls? Do they have adequate human resources capacity to hire and manage staff? We also look if the respondent has expertise in working with a target population and if they have relevant capabilities or infrastructure to serve this group. Finally, we want the organization to reflect and engage the diverse people of the communities that it serves. Next slide, please. Another component that we look at in terms of selection criteria, we look at reasonable costs, budget justification, and leverage of funds. So does the respondent have fiscal capacity to implement the proposed program as demonstrated by an audit or other financial documents? Does the respondent leverage other kinds of funds, in-kind contributions to support the administrative costs of the program? And we look at if the respondent demonstrates reasonable implementation costs, funding requests relative to its financial and human resources. So you will be required to upload a proposed budget that supports the scope of the work. Next slide, please. So as I mentioned in the beginning of the slides, this is our timeline. So the pre-proposal webinar, that's today, April 29th. The applications are due May 27th at 12 noon. And then again, this contract start date would be October 1st of this year. Next slide, please. I will hand this over then to my colleague, Julia, to talk about the e-procurement. Thank you, Julia.
Oh my gosh, thank you, Stacy. Thank you so much and thank you everybody for being here today. So my name is Julia Talbot. I manage the RFP process for the Department of Family and Support Services. I'm going to go over, so Stacy and company, Karen, covered about the actual sort of programmatic scope of the Chore Service RFP. What I'm going to go over today is just some quick tips, and we're going to go through a few things of how to actually make the application. The city does all of its applications, all of its procurement activity through the E-Procurement system. To access the E-Procurement system, you need an iSupplier account. We usually do one amendment, and so we're going to go over on how to accept an amendment so that you will know how to do that, and then I'll talk to you a little bit about how to submit. But first, let's go to the next slide, and we'll get started on some quick tips on how to kind of work best in the e-procurement environment. I always tell people, start early and save often. If you've never done business with the City of Chicago, register into the iSupplier account or platform as soon as you can. It does not take long. You fill out a little screen, and then you have to send an email to the Department of Procurement Services, and sometimes that takes a day or two to get back to you. So that's why we want people to start early on these things, just in case it takes, so you have as much time as you can to actually engage in the actual making of the application or writing of the application. I want you to review your RFP narratives and the application questions closely. So when we develop our RFPs, we have a template, and we make everything line up together, nice and neat. So our narratives feed into or are reflected by our selection criteria. Our selection criteria is also everything else from the selection criteria is also connected to the applications, and all of those things roll into the evaluation document that we use to review and score your application. So if you have a question about sort of how should you approach answering a question, you look to the narrative, look to the application questions or the selection and evaluation criteria in the RFP scope document. Those are where that's like the best place for you to start kind of formulating your answers. You can call Stacy or Karen, you can call me. I won't have anything interesting to say about programs, but you can call us about these things, but you really want to look into the narratives. I know that the narrative documents they're dense. They're not necessarily always easy reading. We're, talking, there's sort of a certain awkwardness when you try to operationalize a program. And so I know that they can be, tough reading, but that's really where your answers are kind of, you're going to get your best direction from reading those scopes. Again, you want to carefully review the selection criteria. So now this talks about some of the mechanics of working in e-procurement. There's a 4,000 character limit, which includes punctuation and spaces. And so each response, each question, or as they refer to it in the e-procurement environment, requirement, is allocated 4,000 characters. E-procurement is not going to count that for you. And furthermore, when you press send, your application is sort of whooshed away. And so if you want to have you can get a PDF of it, but if you want to have a manipulatable file with your answers in it for further grant writing, I really highly suggest that you do this in a word processing, software, and then do the character counts for each question, because the system will not tell you if you've gone over, it will just cut you off. E-Procurement was developed on an Internet Explorer browser. It works best there. Nobody uses that browser anymore because for lots of reasons. It also works fine on Chrome and Firefox and Mozilla. If you are having problems with getting kicked out, or your computer is just not getting along with the e-procurement website, try it in Internet Explorer. This is a system that it can get a little cranky, but it doesn't crash, and generally speaking, it does time out. So, if you leave something open in it for 10 minutes, it will probably accept your answers, but it won't let you save them. Don't use the back button on your browser, because it will also stop saving stuff then. Navigate in e-procurement by clicking on the things in blue. That will take you to usually where you want to go. It's a painful training system, at least it has been for me, but eventually you get the hang of it. But yeah, don't use that back button, because it will pretend it's doing your work, and then it won't save anything. It will kick you out, and then all sorts of stuff will be gone. Let's go to the next slide. So the nice thing about the e-procurement system is that you can submit your application and then later amend it up until the due date, which in this case is May 27th. My favorite day, right? I'm sure it's yours now too. So you can, if you are worried about submitting, you can submit and you can pull it back, and you can resubmit, you can pull it back. You can do that as much as you want. I do tell people to avoid the rush and possible mishaps by submitting early. I'd love to see stuff happen a day before. I would plan on your submission taking 30 to 60 minutes, just because you'll see when we go through the screens, you kind of get, when you go through, it's not just press send and whoosh, it's gone. It's more like press send and, 5 to 50 steps later, you think it's gone, right? Late applications will not be accepted. We don't accept late applications. We can't accept late applications. The only way we can accept a late application is to repost the entire RFP and make everybody who got their stuff in on time reapply. And so we do not accept late applications. Let me just say that one more time. Late applications will not be accepted. We feel badly when people can't, miss our deadlines. I spend a certain amount of time sitting, watching people submit, because we can kind of track where everybody is and see how much you're working. It's, little Santa Clausy, but it's very sad when you see somebody that they're working, you want them to apply, and then you just see them not make that deadline. If you have questions, make use of the e-procurement hotline at 312-744-HELP or customer support at cityofchicago.org. Their email is on the subsequent side that's peppered all over the e-procurement website. It's peppered within the RFP document itself. Just remember, the hotline operates during business hours only, Monday through Friday, 9 to 5. You can call me for e-procurement help as well. I usually answer my phone, so if you leave me a message, I will call you back. And I try to get back to everybody within 24 hours, regardless of what time or what day you call. On the other hand, I don't have as high access as the e-procurement hotline people do, so I might not be as helpful. So again, save opt-in, submit early. Let's go to the next slide. So if you are a new agency, I just want to give you a heads up that these 5 things are things that you will be asked to submit and upload into your e-procurement or your iSupplier account as part of your application. We cannot enter into a contract with somebody who does not have a PIN number, an IRS proof of being able to do business. If you are pending on that, I highly, highly, highly recommend that you find yourself a fiscal agent and do that, because if you're waiting, sometimes these things get gummed up, and if you're waiting on something that's pending and we want to enter into a contract with you, and you don't have the ability to actually operate a business because you're waiting on your 501c3 to be approved, we are not going to be able to enter into that contract. So that kind of operating a landscape is pretty important, just in case you hadn't, if that's something that you're up against. Let's go to the next slide. So here we go, technical assistance. So if you want to know about all the other RFPs we have out, you can go to the alert section or the funding opportunity section of the DFSS website. If you have questions about registration or e-procurement technical assistance, you can go to the customer support at cityofchicago.org or the helpline. If you are a person that learns wonderfully through training, documents, videos, screenshots, you can email me. I have a ton of them. You can go to this website, which will also has pretty much all of the ones that I have uploaded there, and you can get screenshots galore on how to do pretty much anything you want to do in e-procurement. So let's go to the next slide. This is when I start talking about how to accept an amendment. Everybody, we take all of the questions from our webinar. We take all of the questions that people have called Stacy and asked about, and we put them into a sort of an FAQ document. If we had any corrections we needed to make, that's what we would use the amendment. So when it is highly likely that you will have to accept an amendment either to start your application or to continue your application. And so we're going to walk you through about 8 screenshots about how to do that. So let's go to the next slide. So it's like the RFP you are interested in has been amended. It sort of sounds like the beginning of every standardized test question, right? So in order to start an application, you need to acknowledge accept the amendment. The purpose of the amendment, like the purpose of the accepting of the amendment process, as you'll see, is pretty much, we want to make sure that you read the amendment. And if you're not going to read the amendment, we really want to make sure that you at least understand that you're going to be held responsible for the information in the amendment. So if your RFP, if you haven't started the application yet, you would hit on that actions button in the right-hand side and do the create quick quote and hit go. But here you are, or you can here you are in your RFQ and you're going to look at the view amendment history. And so if you go create quote and hit go, that's going to take you to an application page where you can get started. If you need to, but first you're going to need to you want to view the amendment history because that's part of how do you accept. I think if you hit the create quote, it's just going to throw you to the same page, the view amendment history page is going to send you to. So, pick the button of your choice, click it, and let's go to the next slide. So you're going to now begin the acceptance and acknowledgements process. It's really quite transformational. If you want to look at the amendment document itself, you're going to look on the review changes. I have circled with number 2. If you want to look sort of on how it relates to the RFP screen in e-procurement, you're going to to review the amended changes, you're going to look at number 1. I have this little handy dandy amendment description in the middle there that sort of talks about it will be like, these are the questions from the webinar, or we're changing the due date, or, look, a squirrel. When you are done reviewing your changes and seeing what this is about, you're going to hit 3 and acknowledge the amendment. So by acknowledging the amendment, you're indicating that you have actually reviewed the changes and that you're aware and you're ready to be held responsible for the knowledge in the amendment. So let's go to the next slide. And when you get to this, now we're getting into the acknowledging, the accepting, and the coming to, a greater, higher level on this amendment. When you get to this screen, you're going to hit the little tiny box that says, I accept the terms and conditions of the RFQ and acknowledge the changes made in the RFQ amendment document. And then you're going to hit the acknowledge button, which is on the upper right-hand side. That will take you to the following screen. And at this screen, you're going to confirm your acknowledgement of the amendment. So you're just going to read that, and then you're going to hit yes. And that will take you to the next screen. Then you are going to confirm, you're going to click yes. Okay, let's go to the next one. Yeah, there we go. And this will allow you to accept the amendment. You have to click the little box on the bottom first that you say you would accept the terms and conditions, and then you hit accept on the upper or lower right-hand side. This is the final step in acknowledging and accepting your amendment. You're probably a better person, a more whole human being. And then let's go to the next slide. And you were done. So now we're going to go to how do you submit an application in the e-procurement environment. As I indicated, submitting an application isn't just like send and whoosh, it's gone. It takes a little bit more. So we'll go to the next slide. We're starting, the vision is, or the landscape, I feel like the camera pans, you have achieved RFP application nirvana, you are ready to submit, and you are, even more whole and at one with yourself than you were when you accepted that amendment. So you're going to save your draft one more time because I'm a compulsive saver and I assume everybody else is as well. And then you're going to hit continue. At this point, when you hit continue, the application is going to, the e-procurement system rather is going to scan your entire document, your entire application. It's going to tell you the things that it has questions about, right? Which it very sort of judgmentally refers to as errors. The errors messages usually have keywords in them that help you, that if you read, you can figure out what they're kind of getting at. We're going to go through 2 very common ones. On this one, it says the error is you must quote on at least one line in the RFQ. Let's go to the next slide. You'll note that, an error message directs to something left undone in the application. This is, you must quote on one line in the RFQ. You can look down and there's this little tab that says lines. This has to do with the budget. When you click on the lines tab, you're going to go to we review the budget that you submit in Excel as what we base our evaluation on, but e-procurement would like you to put a number in all of the lines for that, for things that happen down the line with contracting. So you're going to have to get, you have to put at least one number in one line, or you can put one number in all lines. And it doesn't matter. You can put whatever number you want. We're not going to look at it for an evaluative standpoint. It just kind of comes to play later in the contracting process. So that's that error message. Let's go to the next slide. We can look at the next one, the next error that I have. And then this is talking about a quote value is required for requirement first name in the e-procurement environment. A quote requirements is the application question section. A quote value refers to the actual text box answer. And in this case, it's the requirement first name was left undone. You didn't tell us your first name. So you would so if you get something about the quote value is required for requirement what, it's basically like you just go in and it says first name and then you type it in and it's good to go. So that's kind of how that's how to solve another very common error that you get. Next slide, please. So after your application is free from errors and you're ready to proceed, and go back to submitting. So at this point, clicking continue should put your application into the review and submit page, and that's because you don't have any errors. You'll notice here in the upper right-hand side, there's a printable view. Remember how I said that e-procurement isn't going to allow you to access your actual application once you give it to us by pressing send or submit. And so this is the printable view. If you press that, you're going to get a PDF printout of basically the whole e-procurement, like all the screens and text boxes and all this kind of all of your answers in their format. It's probably good to have that just as a record. I don't know if you can even access that after you submit, so just do it now and save yourself the trouble. So you could do the printable view, then you're going to save your draft one more time. You'll see this submit button isn't highlighted yet. So, and this is also with the printable view part, like you'll see we can scroll down. Next slide, and you'll see the entire application laid out where if you want to do last minute edits, etc. I got distracted by the printable view icon. So anyway, so you're going to be able to do this. You're going to be able to review your data. You're going to just keep scrolling. So this is this is what it kind of looks like at the top. Look at the bottom. Let's go to the next slide. It's the bottom. And so you scroll all the way down to the bottom, and there's a place for your electronic signature. At the electronic signature, you have to fill in your name and the title and then click the box. If you click the box first, you'll get an error message and you just have to do it again. And then you will say, and then you'll see, okay, let's go to the next slide. So there's another button, see, that I couldn't get into the prior screenshot. And so you will submit. Let's go to the next slide. Because you successfully submitted, you will then get a submittal confirmation screen. The e-procurement system will send a confirmation email within 24 hours. However, if you want confirmation more immediately, call me or email me, and I am happy to confirm that we have received your application. Applications make me happy, and I am thrilled to share and spread the joy and confirm for you. I literally can see you. Like I can see you submit, and so I can watch you do the submissions, and so the minute it hits us, I can confirm. So you can have that immediate rush. That is all I have to say about the e-procurement system. We're now going to open this up for questions. So let's see. I'm going to ask some questions. Oops. Oh, look, there's so many. I love questions. So here we go. Will you share the PowerPoint slides after the webinar? And yes, that's like something we're going to do. Are you going to get a copy of the slides mailed out to us? No, we're not going to mail the slides out to you. We will put them on the DFSS website, and we can post them into the e-procurement environment, but we do not mail slides out to people. and that was asked a few times. Here we go. How will the clients from Chore Services be transferred to CCP?
Julie, I can take that one.
Great.
Sure. So, so Chore Services are funded from the Older Americans Act, and so this is a federal service that serves all older adults. We don't have means testing for this program. The only requirement is that they are a City of Chicago resident and that they're over the age of 60, as well as needing help with the ADLs and IADLs that we discussed. For Chore Services, as I mentioned, there is the short-term chore, which is the 48 hours, as well as heavy duty. However, if the client is needing services outside of that and needing to be referred to CCP, the Community Care Program, that is a state program. So they can, you know, if the respondent is in the home and they might need longer term services, they can always be referred back to our information and assistance line. That's 312-744-4016. Or you can just dial 311 and refer these clients to CCP. From there, they'll have to be screened by the CCUs in order to process those services. But many of the referrals that we do receive through Chore do come from the CCUs and from our MCOs. So these are often maybe clients that CCP, they already want to approve that service for them, but maybe just need like a heavy cleanup. So in that case, they might refer to us to do the heavy duty chore first and then put CCP in place. Or it could be that, you know, again, this is someone coming out of a hospitalization. It might take a while for CCP services to get started. And so they come to the Chore program to assist with that short-term help in the meantime. So again, if you're finding a client that needs to be transferred to CCP, you can always coordinate with our department and that will go to the CCUs.
Great. The next question is, what is the reimbursement rate since it said it is based on reimbursement?
So we in our RFP authorize the service to be provided at the rate of $20 an hour. That includes taxes, but not fringe benefits. But I know currently we actually have different rates for the short-term chore as well as the heavy-duty chore. So you know you're going to be preparing your proposed budget to the department for review, and so you can include your rates in that proposal. You know, we do want to try to be able to match market rate as much as possible. And again, this can be reviewed in your proposed budget.
Okay. Is there a file size limit on the documents that are required to upload? No. There might be, we have run into issues when people have to upload a lot of, say, like photos, or I know with other departments within the city, like technical or architectural drawings, but there is generally, I don't think there is anything that that the DFSS would require as an upload that would trigger that. It has to be quite a large file. Section 2A of the RFP states the service provider will be authorized to provide services at the rate of $20 per hour, including taxes but excluding fringe benefits. Please describe what taxes are considered inclusive of this rate and define the allowable fringe benefit costs. Can you also describe how agencies will be reimbursed for the additional costs associated with supplies and cleaning of heavy chore, deep cleaning, removal of household items, and/or professional pest control services? Stacy?
Yep, thank you for that question. So as far as the $20 rate and how that works with the taxes and fringe benefits, let us get back to you. We're going to review that prior to completing our amendment response, and we'll make sure that that's included in there. As far as the second piece of the question, which talks about additional costs with supplies and removal of household items, again, you can include these costs in your proposed budget. You know, I know, again, for the pandemic this past year, we had some additional funding that came through and we're able to utilize that to purchase PPE and that sort of thing. And so, again, we will more fully address this in the amendment.
Great. What will happen if the respondent cannot staff a particular assignment?
I asked for further clarification on that question. You know, is this because the client does not allow the person into the home? Is there a certain situation? So, you know, we do ask for the respondent to be able to service all of our referrals, but if there's this particular case, you can definitely contact DFSS and we'll discuss those issues on a case-by-case basis.
Right. And then how quickly does the respondent have, you know, in terms of to start the service on the client based on assignments? What's the...
Right. Yes. So I apologize if that was not included in the RFP. That is something that we have as far as a timeline. And again, we will clarify this in the amendment.
Okay. Is it mandatory for us to provide both short-term and heavy-duty chore, or could we just provide short-term chore and still be an eligible applicant?
Right. So it doesn't have to be both. You know, it's either or. So, you know, short term, again, are more for maybe people coming out of hospitalizations, or maybe there might be a transition and they just need that short term help. Whereas heavy duty, again, is more intensive cleaning. So no, it doesn't have to be both services. It could be one or the other. Okay.
The RFP does not list a deadline for the submission of questions for the delegate agency solicitation 7987. Could you please confirm that there is no deadline for questions prior to the due date of 5/27/21, and questions will be accepted via email to Stacy Sabita? I can confirm that there is no deadline. I can also suggest that, you know, if you email Stacy on 5/27 at 9 o'clock in the morning, you know, that is not exactly fair, like to her or to yourself. But we do not generally have a deadline for questions prior to the due date. We do like to collect our questions and put them into FAQ documents and share them with everyone. I can say that, as I indicated in my section of the webinar, we can see who's working on what. Generally speaking, I know that everybody is busy, that we see that our applications are not generally started until maybe 72 hours out. Some people go in, they check out the questions and stuff, and maybe they work at them online. But I have done enough RFPs that I know that people wait until the last minute, which is something that I highly, highly, highly encourage that you not do. Just because, say you have a question that's really involved, say your computer doesn't work. Generally speaking, the E-Procurement system, of course, unfortunately, always works, and it has for the past 4 years, so that's not likely that that is gonna slow you down. But prepare. And Stacy, do you have any deadline that you would like to set in terms of requirements?
Yeah, I don't have a set deadline. I mean, again, as Julia mentioned, you know, ideally sooner rather than later in terms of the questions. Let's see. I mean, it is about a month out. If you can try to get them, you know, maybe by mid-May to us, you know, that would be helpful for us to, you know, review those. So, but again, no set deadline.
Right. Who at the DFSS AAA department do I talk about establishing a regional senior center?
So that is not this particular program. However, if you have questions about senior centers, you know, I can refer you to our Deputy Commissioner, Yolanda Curry. She's the one that manages that program. So I can definitely, you know, if you want to email me about your question, I can pass that along.
Great. Thank you. Just for further clarification, when filling out the application, you mentioned that the line does not really matter for now, but as it is not required for now, but we just need to put any figure in. Yes, please, if you get the error that you have not filled in a line, fill in any number you want. We literally do not look at that screen. We download all of our applications to do the review. We download your budget, your Excel budget, but we don't even look at that screen. And so yes, I am clarifying and verifying that we do not look at the line screen. We appreciate it when you put in placeholder numbers, but you do not have to, but that is not part of the evaluation at all. Is this grant for both the services, short-term and heavy-duty chore services?
That's correct, yes. This grant covers both types of components of the program.
Great. And what kind of caseload can we expect?
So it really depends on our referrals. You know, we do have a target, and again, I apologize that I don't think we put the target number in the document, so we will include that in the amendment. I'm just trying to pull that up now for you. I believe it's maybe 50 clients that we're looking to serve, but again, it depends on the influx of referrals coming in.
Great. So it says, can we serve clients in just specific areas of the city, or do we need to cover the entire city?
So this program is citywide, so we ask that the respondent be able to provide services in all areas of the city.
And it says, is this training recorded? I had an unexpected call and missed questions. Yes, this training is recorded. It will be, the link to it will be posted onto the DFSS website in the next few days. If you have a specific question regarding procurement, please feel free to reach out to email me or to call me or to call the E-Procurement hotline. It says, will we get a copy of the slides emailed to us? No, you will not. We covered that. And how many clients are you looking to serve? I think we also covered that.
Mm-hmm.
The RFP states 41 clients in FY 2020 received an average of 87 hours of service. What is the breakout of the number of clients who received short-term chore versus the clients who needed heavy-duty chore?
I don't have that exact number on hand, but I can again answer that in the amendment.
Okay. Are there any communities we are mostly interested in serving? We are interested in serving people who need chore services wherever they live in the city. It would be my answer, but I will defer to Stacy since this is her program.
Sure, that's correct, Julia. Again, this is a citywide program, and so depending on where the need is, that's the it could be any part of the city that we would like to provide this service.
Here is now we're getting there. The next two questions are basically, are we looking, can you submit for one or the other? Are we making multiple awards? My understanding is that.
Go ahead.
Take it away.
Yes, it is just one award for this program. So they do have to service both short-term heavy and heavy-duty chore.
Right. So you can, so I want to just reiterate what Stacy said. We've had a couple of questions on this. There is one award. It is to serve the entire city, and it is to provide short-term chore and heavy-duty chore. We were looking for a one-stop chore stop, I guess. One-stop chore shopping? I don't know. But
One-stop shop.
The whole city, and we want you to do everything that has a chore associated with it in this RFP. Is that correct?
That is correct. Thank you, Julia.
Okay. So it is $100,000 for both services.
Correct.
It is $100,000 for both services. So, yes, $100,000 to one person for both
services. Yep.
For the whole city. How do you get the clients? That's a great question. I love that question.
Yep. So a lot of the clients will call through the information and assistance line for services. These could be people that are referred to us from discharge planners, or maybe clients that are self-reporting that they need the service. It could be from family members. We partner with our ICAS team, that's intensive case advocacy services, and so sometimes they go out to see homes where vulnerable adults might have situations, where chore services are warranted. And so those people will get referred. And so, anyone and everyone that may be in need of this service. A lot of the times, I think I mentioned the case coordination unit who administer the CCP program. They'll find situations that clients may be in need of this service, and so they refer to us. So, yes, we get multiple referrals from different sources.
Great. And then 50 clients per month or per year?
Per year.
Per year.
Yes.
And you're going to provide a breakdown from the latest metrics of how many people we anticipate, or at least how many people got heavy duty or short-term chore last year, so that people have a kind of a benchmark to work on, although nothing is guaranteed, because it's really, as you indicated about how you get the clients, it's sort of who needs what.
That's right. Yeah, there's no set number of this is how many short-term you have to serve, and this is how many heavy duty. Again, it just depends on the need, but we can definitely get those numbers to you.
Yeah. So these are some great questions. I love a group that is so engaged, and it's always a pleasure. Are there other questions? The next steps on this is that, we're going to answer all of your questions as we did in paper, in an FAQ document. That document's going to be posted as an amendment to the DFSS E-Procurement Chore Services application. We will put the link to this webinar on the DFSS website. We will post a PDF version of the slides onto the DFSS website. We will not be emailing those to you personally. Sometimes I put a link, sometimes I post the webinar slides into the DFSS, the e-procurement environment as well. Although generally speaking, we like to keep everything just posted in one space so that it's just better there. When will it be on the website? I cannot tell you. My hope is that the YouTube link will be on the website in the next few days. The webinar slides, ditto, the next few days. The amendment question, the FAQ questions take a little bit longer because we have to download all of our questions, we have to write up the answers, and then it has to be reviewed by a couple of different people, and so that takes a little bit longer. And so that, so I hope that answers the question about when it will be on the website. I understand that people really like to, one thing actually I did find out is that even if it's not on our, we haven't officially posted it on the website, if you did a Google search of say, DFSS Chore Service Webinar, it does get posted to the DFSS YouTube channel perhaps sooner than it gets posted to the website. And so you can always do a Google search and look for the channel on the link, the YouTube link in Google. Google will pick that up. So that's my pro tip on that. Are there any further questions? Stacy, do you have any final comments that you would like or clarifications you'd like to share? These were some great questions.
Right. No, I agree. I just wanted to thank everybody for joining us today and also asking these very engaging questions. I hope we can get the answers for you for those that have gone unanswered. And so we'll be sure to get that out with the amendment. And yeah, thank you, Julia, for co-participating with me.
Great. Thank you. I really appreciate it. This has been an awesome way to spend a Thursday morning. I can't think of anything better I'd rather do. Go forward. We look forward to getting your questions if you have any, and we really look forward to reading your awesome applications.
Thanks, everyone.
Take care.